This is the Healthcare Education Transformation Podcast, a podcast brought to you by two physical therapists devoted to helping physical therapists and other healthcare providers become better educators to patients, students, the community, and each other by interviewing prominent and passionate people within the realms of healthcare and education. The Healthcare Education Transformation Podcast is intended literally for educational and entertainment purposes only. No clinical decision making should be based on only one source, and therefore this podcast should not be used as personal medical advice. While care has been taken to ensure accuracy, occasionally mistakes and factual errors can be present, as we are only human. This is our journey on the road to becoming better educators, so get ready with your pen and paper as class is about to begin.
Hello, and welcome to another episode of the Healthcare Education Transformation Podcast. I'm F. Scott Fiel, and as always, I'm joined by my co-host, Brandon Pone. We have an interesting guest on tonight. We're lucky to bring you Dave Kittle. Dave graduated from DPT school in 2011 from the University of Sciences in Philadelphia, where he also played college baseball and served as a captain. Dave worked as a PT and a clinical director, but is now the CEO and founder of Vinitial, which is a secure HIPAA-compliant texting app between patients and providers, which helps give information back and forth without exchanging cell phone numbers and allows them to communicate between visits and after discharge. He's also a co-host at PT Tech Talk podcast with Rob Vining, who will be on in a future episode. So, Dave, we're super excited to have you tonight.
Hey, Scott, Brandon, thank you both so much for inviting me on here. I really, really appreciate it. And in exchange for that, I'd like to try to bring as much passion and enthusiasm from my side into this episode.
Yeah, no, for sure. And by the way, Dave, thanks again for what you've done for us. Kind of for our audience, just to give a little background, Dave and Rob actually, when we were first starting this podcast, actually helped us out a lot by doing a video on how to actually set it up. So we're very grateful for that and wanted to extend our thanks that way. And Dave, this is so cool because, we just have the pleasure of having another podcaster on. But do you think you could tell our audience a little bit about your podcast and how you guys are utilizing it to educate the masses on all things PT and tech related?
For sure. So we have the podcast called PT Tech Talk on iTunes, SoundCloud, and YouTube. My co-host Rob Vining, who's also a physical therapist, and he and I were talking about technology a lot behind the scenes, kind of just phone calls and video calls, and he suggested that we start a podcast. We eventually did, and it went from he and I kind of just riffing and talking about technology for the first 10 or 12 episodes, and at that point, we figured that we should actually try to get into the physical therapy world and the industry a little bit more. So what we decided to do is have practice owners and individuals in the physical therapy world that are utilizing and leveraging technology in their practice, so in their businesses for the most part. And since then, the installs, the downloads, the listens have actually skyrocketed, and it wouldn't be where it is without my co-host Rob Vining, who does all the editing and the publishing. So shout out to my buddy and my co-host Rob. And that's pretty much the gist of our podcast, where we're now kind of doing it as content marketing. So it's a way, as opposed to recycling other people's links on social media and sharing content from other blogs or other websites, we actually get to share our links to our podcast, and then we get owners that tell us it's pretty valuable and helpful to hear from other practice owners and hear about what we think with technology. And so it's content marketing. We're getting our names, our brands out there, and our software is out there as well.
Yeah, very cool, Dave. I'm an avid listener, so keep up the good work, man. I appreciate all you guys are doing. Can you tell us about some of the cool technologies you're seeing in the healthcare field and some of your favorite guests that you've had so far on the podcast?
I mean, some of the things that I really think are interesting are more even on the hardware side. So there's a device I believe it's called Scanadu, where you can put a device that's about the size of a smartphone on a patient's extremity, and it would immediately start to read their vital signs without taking blood pressure, without taking pulse, without having to, actually feel their pulse or actually having to measure blood pressure. So those are obviously a little bit more involved and actually cost a lot more money to get up and running. But have you guys ever heard of that, Scanadu?
No, but it sounds cool nonetheless.
It does sound awesome. Do you know if it's relatively pretty accurate, Dave?
I believe it has been accurate, and it was somewhere out of Silicon Valley, and I forget which one I don't know if it was Kaiser or one of the larger hospitals in California near Silicon Valley that were kind of rolling that out and testing it, but I'm not sure about the accuracy.
Cool. No, awesome. Have you noticed any other really, really cool technologies besides that one, Dave, that you think is really going to kind of gain some ground in the near future?
I want to be an optimist as much as possible. And I think there's been a lot of talk about telehealth, but I think also from observing social media and kind of engaging with physical therapists and even physicians and other healthcare providers on Twitter and physical therapy Facebook groups, and even now as we kind of cross over into like Instagram and different hashtags and different communities there, I think unfortunately that telehealth is still going to take some time to mature. It includes the insurance reimbursement. That's a big problem. If someone wants to pay out of pocket for it, then it's not a problem. And so cities like New York City, San Francisco, Seattle, Austin, Boston, Chicago, maybe those cities have individuals with larger amounts of discretionary income where they would, be very open to paying out of pocket to do some type of telehealth consult with any type of healthcare provider, whether it's a physical therapist, it might be a physician or a PA, a dietitian, nutritionist, any individual that's in the healthcare arena. Yeah, I think that's coming, but I think it's not going to be, I don't think it's going to fully arrive until a few more years at least.
Yeah, telehealth seems to be making a really big push. And like you said, I definitely think there's going to be some benefit for both patient and clinician on that. But yeah, I agree. I think you still got a couple years left before it really rears its head and makes itself a known force in the industry.
For sure. And going back to the second question that you guys had about one of our favorite podcast guests that we've had, I would actually say Sturdy McKee was probably my most interesting guest from my perspective when Rob and I brought him on and interviewed him for a couple reasons. And one is that he just seems so clear about the way he was communicating the value of what he brought to the table to his practice. So he's a practice owner and basically set up enough great systems and processes and a team around him to unplug from, clinical care and work on not just his own practice where he's a partner in the business with Jerry Durham, as you guys know, but also having enough time and freedom to pursue other projects. So another project that he has is called ScheduleDoc, and it's kind of, it's online scheduling, kind of going up against ZocDoc and some of these other online schedulers, and communicating with Sturdy about how we have it slightly different than like an EMR, like a web PT or a clinician, where web PT or clinician is used by the front desk and the clinicians only, and the consumer side does not see it, the patient side does not see it or interact with it at all. And with ScheduleDoc and even what I'm working on with Vinitial and even my co-host Rob Vining, who has a live chat box on practices websites, that's also on the consumer side. So all three of us, Rob and I and Sturdy, had a really interesting conversation about interfacing between the consumer, the patient side. How does that involve the physical therapist or not? How does that involve the front desk or the owner who makes the decision to pay for it? And I think that, it was great to hear Sturdy's perspective, because I'm more of a very loud kind of out there type of personality, I feel like nowadays. And that's kind of more like Jerry, his business partner. So very gregarious and outgoing. And then I can kind of see where there's a difference with Sturdy. And I'm just like, I always try to learn from other people. And that is something where I could see Sturdy where he doesn't have to be out there and loud, but just the way that you can engage in conversation with him, what he knows is really unbelievable. So you guys should check him out, sturdymckee.com.
Yeah, no, that's awesome. He sounds like a great guy. Dave, do you feel as though technology is something that the healthcare field is really embracing at an appropriate rate, or do you feel that as though we are ahead of the curve or behind the curve? And kind of where does healthcare fit on this tech curve?
Oh, this is a softball question. This is easy. Healthcare is an absolute laggard with technology, whether it's hospitals, healthcare in general, business owners, academia. I mean, it's just unbelievable how slow the general industry is to adopt new technology.
What do you think that is, Dave? Do you think that that's because of the HIPAA laws and like privacy stuff, or do you think that it's just something we feel like we're too hands-on with and we need to get our manual skills in, or what? Why is that?
I think the HIPAA and the security part is a very small component. I unfortunately just think that it's the way that it's always been. So if you become a physical therapist at a private practice, for example, it just what you see and what you experience. Even when I left my full-time job in New Jersey a couple years ago, before I moved into Brooklyn 3 or 4 years ago, they were still doing paper documentation, and it was just insane. I just couldn't even believe it, that even in 2012, 2013, that practices, and even now there's still practices that are using paper documentation in 2017, which is just crazy. I mean, there's just so many reasons in terms of audit trails and efficiencies and kind of justifying reimbursement. And there's so many reasons why a practice should have that, and how there's still practices out there that don't have that. It just boggles my mind. So I don't know if there's a reason for it. I mean, there's other worlds, like whether it's advertising or fashion or finance, like everything is much more accelerated. And healthcare, for whatever reason, I think it's to minimize risk and trying to just, move at a snail's pace. There's no initiative, actually. There's less initiative, I guess, in our industry to actually take some risk, innovate, disrupt. And I hate to use these keywords, but these are just some phrases that are thrown out there, and healthcare is definitely behind for sure.
Right. So, like, are there tools that should be used in the healthcare field that we're just not teaching our students about, not even bringing up the fact that, like, hey, you could try this program or this app that does vitals and stuff? Like, are those things we need to be bringing into the healthcare field, even at an educational level, at the school level, to kind of say these exist and we need to know about them?
I think it's definitely a possibility. We all talk on social media about there should be more business education in healthcare, especially in physical therapy. There should be more marketing education in the physical therapy education. Well, now we're talking about technology, so now it's like a third piece. I mean, how many, their curriculum is already at like a max capacity, right? Like everything is pretty much standardized, and it's really hard to kind of find different courses and different classes to add into a curriculum. So I don't know how I don't know how a DPT program could add more content, more time, more minutes and hours per week or per semester for business or marketing education or technology. I don't know, because I think you'd have to cut some things out. So I think maybe reviewing the DPT program, kind of finding where's some of this useless time going potentially, and doing it that way.
Mm-hmm. Yeah, it would almost have to be like incorporated into something already being taught, like, hey, here's vital signs, here's why they're important. Oh, and by the way, there's this app that does it as well. Kind of like, something like that, where they're just incorporating into the curriculum already, because like you said, there is such limited time.
For sure. Yeah, that's an option.
Dave, I'm kind of curious about what are your thoughts on overall in healthcare is the use of technology in the classroom? Like, do you think we're doing a good enough job from what you have seen or heard about, or do you think we could be doing a better job, and how could we be doing a better job if that's the case?
Well, when I graduated from DPT school in 2011, a couple classes after that got iPads to go, to use with their curriculum. And I was kind of pissed that I missed my opportunity to get like a free iPad to go through DPT.
Definitely.
Physical therapy is predominantly hands-on. I mean, and it's also interacting with a human, right? So it's like you're listening to a patient, you're asking questions, you're going through a subjective and a history, and then you're doing manual muscle tests, and then you're doing a movement screen, and then you're putting your hands on the extremity or the spine or whichever area you're assessing. So there's only so much technology that I think you could actually add into the program. Could you add more in? I'm sure. I just don't know with the traditional education model with physical therapy. I don't know if there's much room. But of course, there's definitely, as Scott was mentioning, like you could definitely kind of add in some of these other things that are out there and incorporate it into a current module or a current class or current topics. I think that would be the way to go. And you'd have to kind of do it from the top down, right? So you'd have to maybe go and pitch those types of things to either the APTA or the CAPD or the chairs of all the programs or the faculty of all the programs. I wouldn't even know where to start, because with me in the startup world and entrepreneurship, I'm like the opposite of academia. I'm like, do my own thing. I go against, whatever the norm is. I'm gonna, try to move fast. I get frustrated if I had to, be in that type of academic world. So I don't know if that, would be of any, help or assistance. I don't even know.
Yeah. Yeah. It's definitely two different mindsets, two different ways of thinking. Dave, do you see maybe a possible major or like a certification or even some online education programs evolving out of some of the technologies that are out there in healthcare?
I don't think so. And I hope there isn't, because there's already a lot of extra credentialing and specializations all over healthcare, especially like for, let's say, physical therapy. So I've had friends, I've had colleagues that have gotten their OCS or their CSCS or any of these additional alphabet soup at the end of their name, all these extra credentials. And do they become better? Most likely. Can they maybe evaluate and treat patients better and faster and have better outcomes? Maybe. I don't know if there's research on that. But I do know that if you get these extra credentials, whether you're asking about technology credentials, which I don't even think that would be, even needed or possible. But even on the clinical credential side, I just don't see that is helping any of my colleagues negotiate a higher salary or attract more patients or change their, for the investment of doing like your OCS, like it's time to study and then it's $2,000, I think, to sit for the board exam. And for that money that you pay into it, unless your employer is going to pay for it and then not have you sign a 2 or 3 year contract to stay working there, it seems like there's so many downsides to any of this type of credentialing. And I don't know if that's going back to the whole college and university model where that's what they're kind of telling us we need, that we need credentials, that we need extra distinctions and specializations. And I just don't really think, if you look at the actual ROI of like the time and the money invested, it should be way more. Like the return for that physical therapist or that practice should be way more. And I don't feel it is.
Yeah, great point. Great point, Dave.
Yeah, no, I totally agree, because I think a lot of people are going to look at that the same way and be like, well, can't I just go and look at the stuff like on YouTube or programs and just learn it and figure it out on my own? Why do I got to go spend all this money to do it when I won't get much out of it? I think that's very true and a good point, Dave. Now, let's kind of pivot a little bit and look at who many of these tech products are created for. And of course, tech products are designed for a lot of different people, from clinicians, patients, administrators, clerical. But let's focus more in terms of technology, in terms of how trying to improve the patient experience. And what are some of the pros and cons, Dave, that you see for the patient experience in regards to the changing technology that's taking place in the healthcare realm?
Yeah, obviously I'm biased because of secure messaging, the application that we have, but I love approaching it from the patient's perspective. So giving them options about how would you like to be communicated with, whether it's confirming appointments or passing along content or information or opening up channels for that particular patient to ask questions, whether the question is for the front desk, whether the question is for their clinician, their physical therapist. So how would that patient like to be communicated with? Because everyone's different, whether it's phone calls, emails, text message, or messaging. You have to look at it. You have to start from that individual's perspective, because all three of us, we walk into a coffee shop, we might order coffee, but all three of us are going to order different coffee. And so it's from that perspective of putting yourself into that patient's shoes. So what are the pros and cons? I think part of the cons is that these are just additional steps and potentially more decisions for a practice owner to make. So if somebody is interested in improving or just taking a look at the way their practice operates with patient experience, they might realize like, oh, well, we could try this or that. Maybe we'll put a couch in the lobby to make it feel more like home. And maybe we'll offer every single patient that comes in that's waiting for their physical therapist, maybe we'll offer them coffee or tea because that makes them feel warm and hearty. And then they associate our practice to their home. So it's some, psychology there. But further, from that is like, if you're looking to do additional steps, whether it's technology apps or if it's, technological experiences for that patient, some of the owners, the con is that some of these owners are going to drown in decisions to pick which one should I pick, which one should I look for and shop. And so rather than just picking one and then testing it for 2 or 3 months or maybe 6 months and then either reassessing or, stopping that service and then picking another service, because it's still, you want to come from the patient's perspective. But I think that's a huge con, is like there's already a lot of tasks and responsibilities for practice owners and for front desk people, front desk staff and physical therapists for them to be doing. And so a lot of times they are just inundated and they're unable to make a decision on any of this. And I think on the pro side would just be when I kind of just said, you could break it down and say, all right, well, let's pick one thing. Let's pick one automated email system and one email sequence to current patients. And then it also follows up with them after their discharge. And then you're trying to get reviews. And then you're trying to get them to refer their friends or family. And just pick one thing. So that would be, the con would be, there's a lot of choices, and how would a practice owner go about choosing? And pros is like, you have to go from the patient's perspective. So if you do that, you should be okay.
Yeah.
Yeah, no, that's a great point. Great point, Dave. One question that I kind of got for you, Dave, is, with the abundance of technology, and of course, I feel like I'm learning a new software program, a new app, or a new thing every week almost, pretty much. Are there any areas within technology specifically related to healthcare that you feel like we're lacking? Or do you feel like there's any apps or programs or things that we're really not hitting that you feel like we should?
I think it depends on your short-term and long-term goals. So if you want to remain in one practice forever and you're cool with just making a salary and maybe having somebody else do the hard work at the practice, and you're all right with just treating your traditional schedule of patients, I don't think you have to do anything, because I've seen colleagues, unfortunately, just kind of, they're just satisfied with just treating their patients and just doing that. So I've seen colleagues, unfortunately, not want to have any type of, participation or progression of their career in terms of like a personal brand, whether your personal brand maintains and stays at one private practice and you're not part of ownership. I think physical therapists could use, there's just a million things online for them to do, and you guys are already doing it where, with Brandon putting out content and other physical therapists putting out videos and exercise education and different types of education in terms of just like talking through like from the patient's perspective, like layman's terms about different diagnoses, or when to use heat or ice, and all of that all of this just takes some time. I think that's like the easiest start for any physical therapist listening would be like, what are you trying to do? Like, are you trying to be a little bit more entrepreneurial? Because if you are, then then the answer is like, well, there's so many things, and you should be looking at direct response marketing. You should be looking at squeeze pages to collect email addresses. You should be looking at different email automation systems like ActiveCampaign or MailChimp to start because it's cheaper, or Aweber. All these things to start to engage with your current or previous patients, or maybe you start and see patients on the side. And so if you're doing those things, then the answer is like, I have a lot more for you. Like there's a lot more out there. And if you're just going to be satisfied with just treating patients, and there's nothing wrong with that, like if you want to stick with that, then you don't have to do much. So I don't know if that fully answers your question or not, but that's just, what comes off the top.
Yeah, that's some pretty great advice, Dave. I really appreciate your perspective on that. I want to step back into the telehealth model for a minute, because it's something that really interests me. And I think there's a good amount of people in the healthcare realm that are already doing a pretty good job with it. Obviously, it's just starting to kind of breach into physical therapy a little bit. But is that something that you think, again, that we're going to be introducing as like everyday curriculum type stuff for our students in the future? Or is it something that, we're going to have to teach them the laws, the rules, the regulations about? Or is that something more that's going to be just learned on the fly, like once they get out into the real world?
Well, I think there's a difference between what I wish could happen versus what would actually happen.
Yeah, for sure.
So what I think should happen if I were, making $1,000 an hour as a consultant for any of these universities that make a lot of money from all of our tuitions, I would say that kind of like what Brandon said, or Scott, you mentioned, like putting, for example, telehealth into current modules and current curriculum that's already a part of the DPT program. And so if you were to just integrate it in like that, you wouldn't have to make extra space for it. Could you actually do that? I'm sure that if a physical therapy program, a DPT program, were to approach some software vendor that has telehealth, for whether it's physio or it's any other secure HIPAA-compliant telehealth system, could any of these DPT programs approach them and say, hey, we'd like to do a trial, we'd like to get our students in front of your software, because then they can say, we're having, 80 of these students or 70 of these students graduate this year or next year, and then they're going to go work elsewhere and tell others about your software. So would you be interested in having some type of pilot program with our students? How could we incorporate your technology into some case studies, and you can use technology and telehealth that way? I don't know. Like, to be honest, if we had so it's three of us right now. If we had a 4-way call right now, and the fourth person was a chair from a DPT program anywhere across the country, and we asked that chair and we said, hey, what would it take right now, even if it were free, what would it take to get telehealth video into your curriculum for next semester to get your students engaged and get them some experience, even if they were talking and communicating to each other, doing fake case studies, and on one side is a student who's the patient, and on the other side is a student who's the physical therapist. Like, there's nothing wrong with that. But Scott, what's the initiative for the chair or the program to do that?
Yeah, my guess would be just familiarizing their students for what's to come. We're trying to be trendsetters. We're trying to kind of, be in the forefront of technology and what they're going to have to see in the real world in the near future, So for me, that would be my pitch, would be like, hey, look, if you want to be that program that's on the cutting edge, here's what you need to be showing your students and incorporating into your curriculum, because it's going to be out there, and it's going to be out there soon,
If we were to cold call right now a chair of a program and have them do that, I don't know what is their initiative to want to get that into their program. And I don't even know, the first statement I would want to say is Dr. So-and-so, who's the chair, is telehealth even on your horizon? Like, is it even on your roadmap to add into the curriculum?
Yeah. And I very seriously doubt that would be the case in just about any situation.
Right.
I agree.
So, Dave, I'd like to just take a moment here and kind of ask you, if you wouldn't mind telling our listeners a little bit about the technology that you're working on with Vinitial, and kind of your entrepreneurial journey and how it got you to that point.
Well, as I mentioned to Scott when we hung out at the Mets Nationals game, where I was actually loving to hear that Scott actually had an entrepreneurial background in selling golf balls back to golfers at a local golf course, and actually... to me, like, that's still on the top of my head more than Scott pursuing. Scott, you're still pursuing your PhD?
Yeah. So I'm working on my dissertation currently for an educational doctorate for my EDD. Okay.
So, like, as significant and as involved as that, like, the way I'm just programmed right now, I just didn't have enough, like, communication with Scott to even go into more of what he's doing, what you're doing with your doctorate. It was actually more fascinating for me to hear that you and your brother were finding golf balls near a golf course in the woods and cleaning them off and reselling them back to golfers. Like, to me, I'm like, wow, like that's something that, like, you did that outside of education. Like, you did that outside. I think you said you were 12 years old. That was outside of school. That school did not tell you to do that. In school is the opposite. It's like stay in your lane, do your thing. Like, you got to fill in your bubbles and do exactly what we're telling you. And I'm at this point of, like, I'm away from that. I'm just outside of that. And so what we're doing with Vinitial is that we have a secure HIPAA-compliant text messaging app for patient provider and patient front desk communication. And by pitching it slightly differently in the past several months, is we're actually focusing on refilling open appointment slots that are on the calendar for practice owners. So if we can refill open appointment slots that are on their schedules for tomorrow morning, they're actually going to make money during that 30 or 60-minute slot, as opposed to not making money. If an open slot is there, they're paying their physical therapist to be there and not treat somebody. They have their lights on, they have their utilities are running, but they're not making any money in that particular appointment slot. And so, yeah, that's what we're doing with communication and with the HIPAA compliant guidelines and encrypted secure messaging. Physical therapists and patients, they don't even have to exchange cell phone numbers. They can just communicate through the application, and the patient can also communicate to the front desk about any questions with their balance, payment credentials, anything that has to to do with the admin, the clerical side, they can communicate with the front desk, and then they can ask questions and communicate with their therapist as needed.
Dave, I'm going to try to bring out your sales side a little bit, just because I've heard of a couple other apps, a couple other programs that do the similar thing. The big other one I know is Hability. What do you feel makes Vinitial different than those other programs that makes it more unique?
Sure. So Hability, as far as I know, is not in the App Store. I believe they predominantly send messages over SMS, which is an open and unsecured network. And so with us, like if I'm your physical therapist, Brandon, and you're my patient, I would have the application on my phone. You would have the application on your phone. When the message is sent from my phone to your phone or from my app to your app, it remains enclosed and encrypted. And not even us, not even on our side, on the business side, we can't see what the message is saying. We also have, for the practices, a way for them to have public profiles so that they can use in the future and show off to prospective patients and be kind of active on like an open, active directory. So an individual, a prospective patient could hopefully in the future see what type of insurances you might accept. They can call your office right from inside our application. They can get more information about you. So a little bit of a profile picture, those types of things. And as far as I know, Hability does not have, again, profile, any public directory or listing. And again, a slightly different angle. I know James, the CEO of Hability, and I just think that they're going, in a different direction than we are. But it doesn't mean that it shouldn't be out there. Competition's a great thing, and if there was no competition, you're probably doing something wrong. You're probably doing something that has no value and doesn't have demand. So competition's great.
Dave, we kind of like to ask this question to all of our guests as we kind of wrap up. And it's not specifically going to be related to tech, but if you could fix one aspect of healthcare, what aspect would that be, and how would you change it?
Man, I think that if the insurance companies were abolished or not being for profit like they are, let's be honest. If you're listening to this podcast, you probably understand the insurance game, and if you don't, insurance is a cash cow. They're basically trying to pay out less dollars. They have their subscribers, their members, everyone, all of us that are on insurance, they have everyone that's paying into it. We subsidize. If we're healthy, we're subsidizing for the individuals who are requiring or needing insurance. And that's totally fine. That's great, because there's others that need and have a lot more illness or chronic disease, trauma, and those individuals that are on insurance, when they need it, they deserve to have it, and they should have it. But insurance companies will always make money, a lot of money. That's why people like Warren Buffett buy and invest in different insurance companies. And so Warren Buffett's like the second or third richest person in the world. But unfortunately, I think that their initiative for profit, because as soon as they became a private entity, like a commercial insurance, and there's several or endless amounts of commercial insurances, that the profit is more important than the human, the individual, the groups and the individuals paying across every state and across the country. That I don't think will happen, though. So what do you guys think?
Yeah, I think, I'm trying to remember back. Obviously, it's been a while since I was in PT school, but I'm trying to remember back, and I don't know that we got all that much education on the insurance game. I think we really, I at least kind of learned it on the fly, going job to job and seeing how different insurance setups worked. So, I mean, I think if we did a better job from day one educating our healthcare students on how the insurance game worked, at the very least, we would have a knowledge of it. Then from there, we could decide what we want to do with that knowledge. Is it a battle we want to fight? Are there ways to fight or change? Not even fight, but change, the system and the way it's working. Yeah. So I just think I was uneducated in the insurance game coming out of school.
Yeah, I can relate. We did a little bit of insurance in school, but the most of it I learned is when I took Smart Success with Greg Todd, and then I really got to learn about a little bit more about insurance. And I agree with you, Dave, on a lot of aspects. It's an aspect that I don't know if it will change. And I don't know if you guys have listened to the Duck Legs podcast not too long ago, where they had Jared Carter on. Did you guys catch that one?
I've got it downloaded. I haven't listened to it yet. I'm waiting for a time where I can get some quiet time to listen to the whole thing straight through.
No, I didn't get a chance to listen either.
I'll kind of paraphrase it, because to me it was just so striking, and it's kind of something that I think we've all as therapists kind of deep down had a feeling, and now it's just confirmed. So basically what he was getting at was because we all know, as therapists that, Medicare seems to set the precedent on a lot of things. When Medicare makes a move, other private insurances tend to at least follow suit to some degree, or they follow a similar path on average. And what he was kind of talking about was he was talking about the data with Medicare, and normally, a certain amount of people are putting into Medicare for every certain amount of people that are taking out. And I think he said when it first started, it was close to around 4 paying in to 1 person receiving. Don't quote me. I don't know the exact numbers off the top of my head, but I'm just going from what I heard and what he said. And then he said recently, it's closer to 2 to 1. And there have been years already where Medicare has already paid out its max that it should have. And it's scary because, they predicted that the peak baby boomer generations are going to reach their peak in terms of utilizing the healthcare system and services within the next 20, 25 years. And, just looking at the stats and the mathematics, it's like there's no way that the system's going to be able to self-sustain that, and major cuts are on the way. So it kind of, in me, when I heard that, I'm like, I don't know how much we're actually going to be able to change the insurance game, but I think we're going to have to find a different way to supplement. There's no way there. You're seeing it now. Like, it's very hard to actually survive from businesses, from clinics specifically, with just insurance. Look, they got to find other ways to supplement, whether that be through, extra fitness classes or an online nutrition or, programs, or, even do more cash-based pay. The fact is, it's and it's it's scary numbers, but, that's going to kind of force us to change. All right. Well, Dave, thank you so much for coming on the show. And do you think you could tell our listeners where they can find you on the internet and social media?
For sure. Well, guys, Scott and Brandon, thank you both for having me on. I really appreciate it. And if there's anyone that's out there that has questions, they can shoot me an email, dave@vinitial.com. My username is @DaveKittle on Instagram, Snapchat, Facebook.com/Dave Kittle. You can shoot me a request there. Or if you want to stay professional, you can hit me up on LinkedIn, linkedin.com/Dave Kittle. So look forward to connecting anywhere on the internet.
Awesome, Dave. It was an absolute pleasure to meet you and your wife at the Mets game, and I look forward to hopefully meeting up again sometime when I'm up in New York again.
Anytime. You got it.
Awesome, buddy. Have a good one.
You too, guys. Thanks.
Thank you for attending class today, and we hope that you learned something and gained value from the content.
If you'd like to schedule office hours with us, feel free to add us on Twitter @HET Podcast, on Instagram, HET Podcast, on Facebook, the Healthcare Education Transformation Podcast, and the homepage, healthcareeducationtransformationpodcast.com.
And for those of you following along in the syllabus, extra credit can be obtained by liking us, sharing us, and leaving a review.
Let's continue our journey up Mount Educational Success as lifelong learners.